in winning the COVID-19 battle. Since the onset of the disease, the national government has been encouraging county governments to build their capacity in tackling the virus. Now, tonight, Florence Ndungu takes us to Bomet County at the Longisa County Referral Hospital that is producing medical oxygen, a key ingredient in the war against the pandemic. And as she tells us, the county that is under the leadership of Governor Hilary Barchok is not only producing more than it can consume, but also embarked on a humanitarian gesture of offering the excess medical oxygen to neighboring counties free of charge.
It has been months of pain for countries battling the coronavirus pandemic. The unsettling COVID-19 posing a public health crisis and bringing the world to its knees literally. Various safety measures to contain the virus, including but not limited to lockdowns, closure of airspaces, suspension of learning, and ban on gatherings were all imposed. Production of PPEs and vaccines became the center stage. But nothing had prepared the world for what was to come. The battle for air. Life-saving medical oxygen soon became a rare commodity. As the number of COVID-19 infections increased locally and globally, and the virus fast mutating, so did the demand for medical oxygen. Mexico, the United States, Italy, among others, have all seen the worst. A fatal second wave of infections would rock India in early 2021. Hospitals were overrun and crematoriums could no longer contain the dead. People desperately lined up the streets as efforts to save their dying loved ones who were suffocating inside their vehicles shifted the world's attention to the dire need for medical oxygen.
Pneumonia. As I said before,
the pandemic has seen us travel to the Longisa County Referral Hospital, where the colorless and odorless gold is in plenty. The Bomet County is producing more medical oxygen than it can consume.
It produces around 9,000 liters per hour. COVID came in and we realized that that was our strong point. We initially were wondering whether we go for ventilators or oxygen, and we said, and with the advice of some of our colleagues in Mission Hospital, they said, this problem, if you have enough oxygen, you are able to save quite a number of people. People in ventilators can stay for months. One person can stay without ventilator for months, while there's a queue of other people who require it.
As others struggle to generate enough oxygen for their ailing population, Bomet is leading in response to the pandemic.
We have been also able to employ a number of health workers, and we were able also to get support from the national government through the national treasury. Something maybe if were it not for Corona, it would not have come.
There are patients who depend on oxygen and they are using it at their homes. They come and we just fill them for them free. So everybody else comes with a cylinder. Like some of the facilities in our neighborhood bring their own cylinders, they are filled for them, and they go.
Bomet County is in the Lake Basin region and among 13 counties that are highly affected by the coronavirus. Contrary to belief that COVID-19 is only for the big cities, the virus has penetrated the most inner parts of Bomet County. To get to one of the coronavirus survivors, we had to traverse the harsh terrain and even at some point, vacating our car to get to this homestead. Well, as we continue to trace the tales of COVID-19 survivors, our endeavors has taken us to a village called Moburu. It is situated in Bomet East. Well, currently I'm standing at the homestead of Mama Rachel Lagat. She is a survivor of COVID-19. just a few days ago, she was dismissed or discharged from the Koiwa Isolation Center. But as you can see, we are deep into the village, and this only goes to show that COVID-19 can get you anywhere and at any time, and it can get anyone. Mama Rachel Lagat is a farmer. She grows a variety of vegetables that she sells at the Bomet market. It is here that all her trouble began.
I think my mom got it from market because she always do there.
The revelation that she had contracted the virus weighed so heavily on her family, especially her daughter, who had to be isolated alongside her at the Koiwa Isolation Center.
There was fear. Everybody was fearing us. They ran away from us, but tukamwambia hatuna corona, they are now coming to visit us.
But that is nothing compared to the stigma they had to endure.
Wanauliza tu hapo kwa njia, mama ako namna gani? Na wanatoroka.
Even us, we fear that because they have run away from us, hatutasaidika.
Wesley Kirui is another lucky COVID-19 survivor from Bomet County.
Kila mtu, hata even my children, yule wa miaka miwili, hakuna mtu alikuwa anataka kukaribia. Hata kupita njia karibu na mahali naishi, watu walikuwa wanapita mbali sana.
As Wesley tells us, stigma was heavy than battling the virus itself.
When they see you unwell and you've been admitted in an isolation, people shy away from you or your relatives.
Unfortunately, the number of infections is escalating in the county. And a little surveillance around Koiwa reveals exactly why. This is the Koiwa market. It is located just a few kilometers from the Koiwa Isolation Center. And if you thought the isolation facility would serve as a constant reminder of the lurking danger, think again.
People would want to comply with the protocols to satisfy somebody. Maybe because there is an enforcement officer around, or a chief, or the governor. So this is about our lives. And we'll continue sensitizing the people. Of course, our people can also be very reckless. But we need to remind them that unless we protect ourselves, then we'll be exposed.
It is market day. People are freely congregating without keeping any social or physical distancing. To make matters worse, it is as if the residents of Koiwa have never heard of face masks.
We have, especially in rural areas, there is this thinking that, the disease is in Nairobi, it is in Kisumu, it is in Bomet town, and not in the rural areas. In fact, that is where we have problems.
We realize that some of the problems that we have deal with the people who, on a certain day in a week, they congregate in markets. So we thought we needed to have a team that is comprised of people in the urban setup, especially in the Department of Lands and Urban Setting, urban lands. And then we have the security officers and our Department of Trade. That forms a committee so that they can approach the traders and the business people on what to do on that.
Behavioral change is required not only in Koiwa or Bomet as a whole, but in the entire country. During our visit at the isolation center, there were only 4 patients at the 220-bed capacity facility. However, lack of adherence to the set containment measures could see the isolation center not only fill up with patients, but get overwhelmed.
There are a number of deaths that we've not been able to account for. The numbers are just too many. So, and that could be an indicator that we have a problem in the community.
Survivors of COVID-19 are thankful for one thing, that treatment in Bomet is free of charge. Otherwise, they do not see how they could afford it or even access it if the county did not have the capacity to produce its own medical oxygen.
Tunashukuru serikali ya kaunti ya Bomet. Hakuna kitu tulilipa. hakuna kitu, yenye tulilipa tu ni chakula tu, ile ya kusema kununua tu matunda.
So hapa Koiwa ni free, wanatibu wagonjwa, karibu hata wakupatia transport urudi nyumbani.
We have saved a number of lives, not only in Longisa or in our isolation facilities within the county, but in our neighborhood.
Counties such as Kericho are also benefiting from free oxygen produced at the Longisa County Referral Hospital.
Prevention, if we can do those basic things like washing hands, sanitizing.
The cost of treating COVID-19 is prohibitive, and many patients have died globally due to lack of oxygen.
And I think one of the reasons is that people are depending on oxygen they get elsewhere. You can imagine if somebody is using 10 liters per hour of oxygen, or even 15, because I'm told it can go even up to 20 liters per minute, actually, not per hour, per minute. So if you are using such amount of oxygen, it means somebody has to be on the road all the time looking for that oxygen. So the cost also involves the transportation, apart from the gadgets that they use, apart from the staff.
Call for all counties to start producing medical oxygen for their facilities is being floated.
I would encourage that each facility generates its own oxygen, and I think this is where we require support to go in. And even those ones who have, improve on the capacity.
We need to take care. This is a disease that can kill, and let us comply with all the directives and protocols that have been given by the Ministry of Health.
It is not clear when the nightmare that is COVID-19 will come to an end. However, keeping our guard high at all times by adhering to safety measures imposed by the government and the World Health Organization is a sure bet of keeping us all alive. And as they say, we are not safe until all of us are safe. The Bomet County COVID-19 Isolation Center is nothing short of impressive. As you can see, they are ready. This particular facility has a bed capacity of 240 beds. However, they are hoping that we do not have to utilize this facility to its capacity, that we don't need to have a lot of patients being treated here due to COVID-19. And for that to happen, a lot of sensitization needs to happen, and it's still happening on ground, so that the citizens do not lower their guard and so that we can avoid a public health crisis. For KUTV,